Okay. Okay, thank you. Breast cancer is one of the most important public health issues which affect globally. According to American Cancer Society, breast cancer is the malignant tumor that starts in the cell of the breast. It is the most common diagnosed cancer in women in North America, and it is the second cause of death from cancer in women. Breast cancer is also common cancer and has the most mortality rate of women worldwide. Breast cancer is a disease of human cell. Normally, cells divide and multiply orderly, but once a mutated gene develop and continue to accumulate into the body, and it becomes a tumor, and which also becomes a cancer, which also we call it malignant. When the cancer spread to the part of the body, which we will call it metastatic disease. As we learned from anatomy and physiology class, the breast is a sweat gland, ectoderm in origin. I'd like to show you this. This is how it is when the lymph nodes and how it is when the cluster of the cancer in the lymph nodes, the cluster of the cancer in the lymph node where it spreads, and what it is when there's a lump is actually in the breast. And so today I wanted to provide you an overview of breast cancer and the method of treatment of the breast. It will include the etiology and the risk factor of breast cancer, the statistic of the types of breast cancer, the signs and symptoms of breast cancer, and the screening of it, and also the pathology of the pathophysiology of breast cancer, and also some of the treatment of breast cancer. Once a patient is diagnosed with breast cancer, and they will be treated with multiple doctors. One approach is especially the surgical oncologist, the radiation oncologist, and the most important, the medical oncologist. This approach is just to reduce the breast cancer mortality rate and the recurrence of the disease. According to Abraham and Shama, in order to diagnose a patient with breast cancer, it would have required many of the prior treatments planned to determine it, such as physical and history examination, the bilateral mammogram, the biopsy of the lesion, a lab test, pathology test, radiograph, MRI, and the PET scan are also being used because we need to scan for any metastatic disease and whether the disease is spread to other part of the body. There are many risks of breast cancer, but the risk of breast cancer increases by age. So according to Austro, incidence of breast cancer in Caucasian is the highest at age around 50 to 59, dropping after at 70. And this is what I wanted to show you. In early age, also there will be increased if the female has an early age of being in menses or a delayed menopause, they also increased rate. If a patient with family history of breast cancer increases women's risk of having a breast cancer or other previous cancer, they also increase in rate of breast cancer. Other factors such as environmental exposure and healthy lifestyle and also obesity will increase the risk of breast cancer. In United States, the lifetime risk of developing breast cancer for a woman who lives until age of 85 is 1 in 8 women. It is by far the most leading diagnosed cancer, being the second leading cancer death in women. Breast cancer is also the most leading cause of death women that are in age 40 to 49. Breast cancer derived from epithelial cells that lines in the dermal ducts, lobule unit. There are 2 types of classification of breast cancer. There are non-invasive and invasive cancer. Cancer cells that remain in the basement membrane of the terminal duct, lobular and draining ducts, and the classified in the C2 and also called invasive. But once they are spread, the cancer cells are spread outside of the basement membrane, and into the ducts and into the adjacent tissue, as I showed you from the first picture, which is the difference between this and that once it's spread and not being spread, and then they will be classified as invasive cancer. The most common symptom of breast cancer is a newly discovered of a mass, which is such as lumps, hard lumps, or painless or irregular edges. They are most likely malignant when they're irregular edges, when they're painless. On the other side, if the tumor is relatively soft, tender, with smooth edges, then they are more likely to be benign. However, for Paget's disease, Austro mentioned that a percent would look like an enzyma or dermatology problems, the bleeding ulceration, the itching of the nipple, which are often misleaded and mistreated as a dermatology disease. There are many ways such as varieties of imaging studies that use to identify patients are suspicious for breast cancer. Mammogram screening has been one of the most important and the most traditional way to detect patients with suspect to have breast cancer. Ultrasound, also a common, and also for MRI, which are also very common to have many supported data. The fact that majority of the patients with newly diagnosed breast cancer in the United States have no evidence of metastatic disease. This is because the healthcare system that we have, that many of the women in the age of 40, they start to have a yearly mammogram. This is why many of the breast cancer are diagnosed early. So in early stage of the breast cancer who underwent surgery, either lumpectomy or mastectomy of the region removed or followed by treatment depending on how severe of the disease. And for patients who prefer to have a conservation of the breast therapy, the goals of the surgery or the treatment is to decrease the recurrence rate of the disease of breast cancer. So in most cases, most completion of the BCT, which is the breast conservation therapy, they are surgical removal of the tumor with the margin needed to be cleared, followed by radiation to the breast. So options such as mastectomy or anything, they wanted to have reconstructive surgery, and they could do it in a later time. There are one new genetic testing that I want to talk about and share with you, which is called the BRCA1 and 2 gene testing. They are actually it is very expensive. They're about 4,000 to 5,000 blood tests where they can detect whether the female has a genetically mutated breast cancer, which is also, there are only about 5 to 10% of the women who have breast cancer may have this mutation disease, a mutation gene. It is the most common in patient who has a Jewish ancestry. And example would be Angela Jolie, who also maybe many of you may already know that she did this test, and she was diagnosed with positive for BRCA. So she go on and have the mastectomy and as prophylactic mastectomy. So breast cancer, it is one of the issue that we need to concern, and we need to prevent, and it could be done. So hopefully every one of us, when we hit the age of 40, we know what to do and how to prevent it. Thank you.